Um, okay, so I I'm amazed at how many things can go wrong with us and how they actually don't for most of us. So and the first part, a large part of this number, part one, is about the heart and the circulation, and that's the one that that's what I started off with, and it just grew and grew. So other things have moved into the second part, which will be in a fortnight, which will be our last lesson for the year. So, so what can go right, or what's gone right so far? So our systems, we all the things that happen to us on an everyday basis, especially on a chilly morning like today, keeps us warm, we're alert, but it also keeps us safe from infections. Most of us don't have any infections. Most of us are just on a normal, everyday basis, living, and you know, you might have a problem with your back, or you know, you're coughing a little bit or whatever, but there are so many systems in us, and after 60, 70, 80 years of life, we still are going, even though the body renews itself constantly. You know, we get our oxygen, we digest everything, and everything's just doing really, really well. Most of us also drive, not just to stay awake long enough to make sure you get from point A to point B without crashing. That is actually quite a process as well. And just to be able to walk around the block at this sort of age. Now, medicine has been absolutely wonderful for us, because, you know, if you go back 50 years, someone in their 60s were very, very old. And there were many things that they died of. My father died of a problem that he had, which I've got, which I had, it's been fixed. I'll tell you about that a bit later. And both my daughters have got. But so I'm still here. In fact, I'm 10 years older than my father died of the same problem. So things are really, really good. Now, we having survived so long, and I'm using 60. It's not a cutoff; it's just a number that I pulled out of the hat. How is this possible? Well, we are functioning well enough to be sitting here. You can hear me, you can see me, you're thinking, hopefully, what I'm saying, and hopefully taking some of it in. So, but other parts are starting to malfunction, even though you may not realize it. And once you start realizing, then you go and see your GP or your specialist, and they might be able to fix it, might be able to help with something. So our knowledge is increasing exponentially. Just, it's not in a straight line, but zooms up. It's very, very amazing times that we live in, medically and scientifically. And now, that's what I just said. If our system starts to misbehave, we can we have people who can sort it out. If a GP can't help, he'll send us to a specialist. So the sort of things I want to look at is heart disease, hypertension and high blood pressure, atherosclerosis, it's blocking of arteries, dementia is a big thing, type 2 diabetes, arthritis, cataracts, hearing loss, and other things will come later. So I don't know exactly what you guys understand about how the heart structure, how it works, and what keeps it going, and how it can beat. But the top and bottom beat at different times, hopefully. So I have to give you a few names, and that's the only way I can talk about it. So the upper chambers are called the atria, one atrium, two atria. The lower are the left and the right ventricles. Now, there are valves, and this is part of the problem. These valves which are moving all the time, that's where many of the problems arise. But you have to have a one-way flow. You can't have it going backwards. So that causes problems. And because the heart and the lungs are really in touch with each other all the time, you can't afford for the blood to backflow into the lungs, which is what happens. So just a very brief summary of these valves. Now, the blood comes in through this vessel here from the body, the vena cava, and comes in to there. There's a I've lost it already. A valve here, and it's got three flaps, if you like, three leaflets, and so it's called a tricuspid. It goes into this. That's a right atrium, and don't forget, if you're looking at an anatomical diagram, you look at it as if it's in a person. So this is the right-hand side on our left. So the right atrium, the blood moves through this valve, through the tricuspid into the right ventricle, then up, and then it compresses and pushes the blood up through these pulmonary veins. It's actually the artery, because it's moving blood away from the heart, but arteries normally move blood with oxygen in it. These are going to the lungs to pick up the oxygen. And there's a valve there. It's called the pulmonary valve, pulmonary meaning the lungs. Then from there, it comes back into the left atrium. And there's another valve here. It's called the mitral, and it's made of two flaps. And it's called the mitral valve because someone, probably a medico some time ago, was looking at it, and it reminded him of the mitre that bishops or the Pope, I don't know, someone in the Catholic area, it's in two parts like that. So it's called the mitral valve after the mitre, goes down into the left ventricle, up through the aortic valve, very important valve, and into the aorta. Aorta then is this massive one that comes around, flushes around, goes down to the body. But these three here, these two go up the neck, the carotids and so on, and then also to the arms and the rest of the body. Okay, so the other thing down here, there are biological valves and mechanical valves. So if any of these valves here, there's 1, 2, 3, 4, and if there's a problem with any of them, they can be replaced. And the biological ones are usually pig valves, and they are scrubbed of anything that could, what we call antigens, and they're inserted there for life. Or you can have a mechanical valve, and there's a problem with that. I'll get to that later. Okay, so what sort of heart diseases can we get? So a normal valve, that's what it's like when it's closed. If it starts fraying at the edges, it's not closing properly, and that's called a stenosis. And if you have a look, you can see that there's a gap, so you get backward flowing blood. Now, you can have an aneurysm where you get a weakness, so you get a big bubbling of it just opens up, and it can cause all sorts of problems. You can also get a coronary disease. Now, the coronary arteries are the ones coming into the. That was what I forgot to mention. Is going back down here. These ones here go straight into the heart itself. So the first tissue that gets fed by the fresh blood that came back from the lungs is the heart itself. So the coronary arteries are these, and you get fatty tissue, fatty deposits there, and then that causes problems. The heart, the atria, and the ventricles, the two atria contract together, and then a small amount of time later, the ventricles contract. But there are problems there. One of them is an atrial arrhythmia, where it just goes crazy. It really just flutters. It doesn't pump at all, and that causes problems. You get heart failure, where and notice here in this diagram on the left that the thickness of this wall here, well, it becomes thinner and thinner, and it doesn't have the strength to pump the blood around. On the other hand, you get the opposite, where you get a thickening, and you can't pump enough blood, so there's not enough space there. And pericarditis, and the pericardium is a very, very thin, pretty strong tissue right around the heart. So it sits in a bag, and you get inflammation, and itis means that. So the pericardium, the peri, and the card means heart, and inflammation, and that causes decent issues. So what sort of valvular heart disease? Okay, so the valvular meaning valve stenosis. It means it narrows. So it stiffens up, and the narrow the size means that not enough blood's going through. So the person that's always feeling weak, this can't do much activity. It's really not a very good way to be. And you get a prolapse, where it just flaps, and it just slips out of place and bulges. And that means blood will flow both ways instead of just one way. It's not a true flood. You also get regurgitation, leaking, and that happens in conjunction with the prolapse. And so what happens is when the valve doesn't stop the blood coming back, you get a little bit of a gap. The blood goes backwards, and especially if it's in the left atrium, it pushes blood back into the heart, fresh blood, but back into the heart, back into the lungs. And then you end up with fluid in the lungs. That causes problems. And so this one here, the regurgitation, you can notice here it's through the valve due to the stretching of the tendinase. I'll get to that in a minute. So a healthy valve closes perfectly. A diseased valve, when it's closed, is nothing like it, which means you get seepage. This one here, the aortic valve, as an example. When it's open, it's fully open. The diseased one, when it's open, it's partially open. It just doesn't have the subtlety, the suppleness, rather, that it should. So it can be repaired, and it can be replaced, these valves. And this is my story, my father's story. and it's normally done with open heart, and but mine was minimally invasive. They actually went now single hole from the side of the chest into the heart, because my valve was a mitral valve. That's the one on the top, on the upper left. And because that part of the heart is a little bit higher than the rest of the heart, you can get into it from the outside. And so when I saw the surgeon, and he said, what sort of valve do you want? And I said, what choices are there? He said, you can have a scrubbed pig valve, or you can have a mechanical valve. And this mechanical valve, I said, can you hear it? He said, yes. I said, we talk about it, and you hear this click, 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 click for the rest of your life. And so I said, I'll go for the pig. And when he got there, I didn't need that. But what he did, these tendons, the little tiny little tendons, he made 3 of them for me, because my old one stretched, and it's been perfect. Now, this is quite a regular thing. As I said, my father had it, but in 1965, when he died, they didn't have this sort of operation. My 2 daughters both have. It's called, the doctors hear it. It's called a murmur, because I can hear the blood going backwards, back into the lungs, and I have to have an annual cardiologist visit just to check it. And the first thing he does is listens, and there's nothing, it's all good. I'm still here, by the way. Okay, so the valve can be replaced. As I mentioned that. Now, the scrubbing means that any possible antigens, any sorts of tissues that can act as an antigen, which our body will fight against and destroy, is scrubbed. So it's only mainly the cartilage that will stay, and so that works. Again, I didn't have that, but that's what they do. The mechanical one, you have to take warfarin for life, because warfarin is an anticoagulant, so it stops clots happening, because it's metal and plastic. The metal part, blood clots on it, so it's not a good thing. And so the little cords or little tendons, they keep the flaps in place, so they just keep doing this and this. If one gets a little bit longer stretched, then there's a little gap there, and so then you get the backwards flow. So this is regurgitation, and it's mainly the mitral valve, but because of the pressure, I didn't mention before, the left ventricle, the bottom left one, is the one that beats the strongest, the biggest muscle, because it has to push blood to the whole body, from the head to your toes. So massive pressure, and that affects the valve and pushes it back into the atrium above it. So the replacement that I had, these little bits of tendons, fresh ones, a Teflon thing, and this is the polytetrafluoroethylene. That's the maker. That's not the maker. Sorry, the component, the chemical, and it's been great. Now, here's a regurgitation. This is one of the most common problems at our age. So here you've got the left ventricle, and see the muscle in the diagram, how big this muscle is, how thick it is compared to the rest of the heart. So this is where it normally goes up around the body through the aorta. But here, because of the pressure, it's unrelenting. So it goes back. You get this collapse. You get the stretching. This is a normal one. Now, aneurysms happen. And an aneurysm, excuse me, an aneurysm is when there's a weakness in the vessel. And again, this is all under very high pressure. And when you get weakness happening through degeneration of a section, it starts to balloon out. And if that bursts, you're in deep shit. There's not much they can do unless they can pick it up early. Because the heart will keep pumping and blood will keep filling your body through this thing, this aneurysm. It's not good. So it stretches, gets thinner, and you get this fatal bleeding. And the most common reasons for it is a thing called atherosclerosis, where you get a buildup of a lining of fat and other things. And so you don't get the elasticity. And then you also, and high blood pressure. And if you have high blood pressure, I'm sure you're on blood pressure capsules, the tablets. The medication is so important because this is one of the possible results. And it often happens in the brain, a brain bleed, not good. So deep wounds and infections can also lead to an aneurysm and a birth defect with weaknesses. And so it varies, but a lot of it, like the atherosclerosis and high blood pressure are controllable, and this often is used. Often diet can help as well. If it's getting bad, they can put a stent in, and it's a stent that just thread through the artery, and it's all squashed up, and they'll release it. It opens up and just controls that area. Excuse me, I'm just switch it off. Okay. And where are these aneurysms mostly? The major arteries, that's where the pressure is, in the thoracic, that is the chest or the abdomen, in the brain, behind the knee. I didn't know this one, I just found it, and it's called a popliteal artery aneurysm. For some reason, behind the knee, it's some sort of weakness, maybe because it bent a lot, I don't know. In the intestines, there's the artery that feeds the intestines, the mesenteric artery. That's common. And there's one that goes to the spleen. So, this is all something to look forward to, I guess. I hope not. So one way of sorting things out is open surgery. But now it's minimally invasive. So like my heart operation was minimally invasive. I didn't have an open heart surgery. It just went in from the side, it went in, had a look, and everything was good. So now to repair an aneurysm, the doctor would use a graft. It's a man-made tube here. You see here quite nicely, and it replaces the bulge. So it's a stent, and you can see how it bulged before, and then by putting the stent in, it takes the pressure off that area. So this is not that new, but the materials that they're using for the stents are changing and improving regularly. So coronary artery disease. So the coronary artery, how it develops in the major blood vessels, and mainly the ones that supply the heart, and when they become disease or whatever. So this is where the plaques come in. It's cholesterol, and they deposit in the inside the arteries. Now the coronary arteries are the arteries that the first vessels that come out of the heart, and they come around and back into the heart to feed the heart, and they become more and more of the plaques form, and so less and less blood can get through, and it causes all sorts of problems. Also, it causes inflammation, which makes it much worse. So there's a lack of oxygen and a lack of nutrients to the heart. Now, if it happens to a muscle somewhere in the body, you can have a rest. Unfortunately, with the heart, it can't stop. It can't rest. So it's got to be fixed. Now, also the plaque I mentioned before, cholesterol basically, it decreases the flow into the heart. And then you start, one thing that can happen with the reduced flow, you get a chest pain. It's called angina. You can get a shortness of breath because you're not getting enough oxygen in. And then there are other diseases as well. And if there's a complete blockage and a bit of, for example, a bit of cholesterol plaque breaks away from somewhere, ends up in there, it'll block it. If you block blood supply to the heart, then you've got a problem. It's called a heart attack. And it depends where, which particular artery and so on, but it's not good. Not good at all. What can cause coronary heart disease? Again, damage or injury to the inner layer of the artery, that's what I'm saying. Sometimes as early as childhood. And what can cause this damage? Not so much in childhood, but smoking, high blood pressure, that can happen in kids, high cholesterol, it depends on the diet to some degree, but diabetes, insulin resistance also is an issue, and not being active, sedentary lifestyle can cause this as well. Can, not will, can. And once the inside of the artery is damaged with fatty deposits, it's plaque, and other rubbish that's picked up, it makes it difficult for blood to get through, and that is called atherosclerosis. The plaque and the surface, it breaks up, ruptures. Platelets, now they're the part of the blood that clump together to form clots, which is good, which is what they're there for. But if you've got a bit of a plaque surface that breaks or something, then the platelets see that they're not an intelligent cell. But if there's a break, if there's something rough, they'll start to clump there to repair it. But this causes a blockage. And another heart attack. So what are the risk factors for coronary heart disease? Well, we have age, sex, family history is a big one. Smoking, definitely. High blood pressure, high blood cholesterol levels. We don't hear much about that these days, but you think back, I don't know, 15, 20 years ago, everybody was talking about cholesterol. Diabetics have a problem with that. Obesity, being overweight, physical inactivity, and on top of that, with a high stress and an unhealthy diet, you've got a problem. So, people need to realize this, and if any of this applies, they can all be fixed somehow. And arrhythmia is a fault, a problem with the heart's electrical system. That's got a very, very definite system, and that affects the pumping, the rhythm of the heart's pump. Now, it makes an arrhythmia, it makes the heart beat too fast or too slow or in some irregular way. So normally you don't feel the heartbeat. With this you can. And the most common one is the AF, the atrial fibrillation. That's the top left, the atrium, and it sort of it flutters. It just flutters, and that causes a problem because the blood is not moved through to the ventricle, and by being moved around like that, they start forming clots within it. And so it's just not, it's not squeezing, it's just fluttering. A person gets quite sick fairly quickly. And so you can have a heart attack, which could cause this. Smoking will cause it. Congenital issues will cause it. Stress causes it. Don't know why, but it does. Some medicines will also cause arrhythmias. And our doctors know which ones they are. I don't. So now medication can control abnormal rhythms, but ablation procedures can cure some of this. Now, an ablation is where they go in, and it's happened to two of my friends. They go in and using an electricity, they zap it, if you like, to kill off those nerves which are causing this problem. And it's worked beautifully. They had this wire, it's all done on, I'm not sure if they're out or not, but it's a fairly quick process. Heart failure, it's a condition that develops when the heart doesn't pump enough blood to the body. So this can happen if the heart chambers can't fill up with blood. If the muscle is just too weak to pump, the heart doesn't stop, but it doesn't pump properly. This can happen just suddenly. It's called an acute version, or slowly. It's chronic. It's better to get the chronic one because you can sort that out more over time. And it can affect both sides or just one. The left side and right side may have different causes. So it's all sorts of things. And heart failure mostly is caused by another condition that damages the heart. So what else is there? They include coronary heart disease, heart inflammation, not good. High blood pressure, controllable, cardiomyopathy, that's where the heart muscle weakens, and irregular heartbeats. And so heart failure can build up eventually. You feel tired, you're short of breath. There's build up in your lower body because there's not enough pressure to bring back the fluid in different parts of the body there, around the stomach, around the neck. It just swells up. The heart failure can also damage the liver and the kidneys. Then you've really got problems. You also can get pulmonary hypertension. Now, pulmonary refers to the lungs, and hypertension is high blood pressure in the lungs. So what happens there is you end up with fluid in the lungs, liquid under high pressure in the blood vessels in the lungs, and the fluid's pushed out. So an irregular heartbeat can do this, valve problems, you get sudden cardiac arrest out of all this. Currently, heart failure is a serious condition that has no cure. However, treatment, lifestyle changes, medicines, and so on, some devices, I'm not sure what, I didn't get a chance to follow the one up. And it may help control it a bit and a better quality of life. Cardiomyopathy, it's a disease of the heart muscle. So the heart becomes enlarged, it becomes thicker, or it could be just rigid, it can hardly move. So then if in some cases, this tissue, because it's hardly moving and it's really thick, it develops, it's replaced with scar tissue. Now, scar tissue does not stretch, and then you've got a problem. So in cardiomyopathy, as it gets worse, the heart becomes weaker, less blood being pumped, and it's having trouble maintaining the normal rhythms. So it can lead to arrhythmias. Arrhythmias are irregular heartbeats. And then you've got other problems. So in terms heart failure, it just builds up fluid in the lungs, in the ankles, the feet, the legs, because in the lungs, because of the pressure, in the feet, well, down the bottom, because there's not enough pressure to bring it up again. And the weakening of the heart can also cause other things like heart valve problems. And we talked about that earlier. Now, cardiomyopathy, that's made of three words, if you like. Cardio is heart, myo means muscle, path means disease. So hypertrophic cardiomyopathy, which means an enlargement of the heart. Dilated cardiomyopathy is enlargement, but it's much more floppy. It just sort of like a balloon about to burst. A restrictive one where the blood doesn't flow particularly well. Arrhythmogenic, right ventricular dysplasia. It just sort of basically collapses and doesn't perform as it should. And there's another one called unclassified, and I don't know what that is. And it could be acquired or it could be inherited. So anything can happen. Now, some people with cardiomyopathy have no signs or symptoms at all and no treatment. It's there, but it's not that bad. Others, it's happening really quickly. They're very severe, and it could be very, very serious. So how do you treat it? Lifestyle changes, medicine, surgery, implanted devices to correct it. So you can have wires coming in, what's it called? What's the word? Not coming. The little device that they insert in and send the appropriate beats, signals, electrical signals to the heart, so it beats correctly. The pacemaker, I knew it, and there are non-surgical procedures. So all these treatments, we need to control the symptoms. Now, all of these have complications, so you need to do that, reduce it, and you need to stop it before it gets worse. So, yeah, it's interesting how much can go wrong with the heart. And the amazing thing is, for most of us, it doesn't. Another thing here is the endocarditis. This is inflammation of the heart. The itis, it means inflammation. Endocarditis is the inside of the heart. Myo is the muscle of the heart. And the pericarditis is the pericardium, which I haven't mentioned yet, is a membrane, it's a sac that the heart actually sits in. It surrounds the heart. So endocarditis is the inside lining, and the myo is a muscle, and the sac around it. So all these situations cause heart inflammation. It could be viral, it could be bacterial, or some other medical condition. And there are certain signs, symptoms, depending on what it is, for the doctors to be able to try and diagnose it. Treatment, possible surgery, some procedures, and the problem is the complications, and that could arise, and you end up with heart failure or just an irregular heartbeat, which is not comfortable. Then we get to hypertension, high blood pressure. It's common, and if it happens long term, the high the pressure against artery walls, and then it could cause problems because of the time, the timeline, if you like, of how much pressure goes into all this. Various forms of heart disease. But the blood pressure is determined by the amount of blood that the heart can pump, and how much resistance there is in the artery. Now, the arteries have plaques inside them. Two things happen. One, they don't have the annulus, they don't have the size that they require, but also they don't have the elasticity. So that causes issues. And the more blood that the heart pumps, and the narrower the arteries, the higher blood pressure. That's a major issue. So a blood pressure reading that's about blood pressure, is given in millimeters mercury. Now, if you remember in the old days, a doctor would have a little elongated box. He opens it up, takes it, the cuff, puts it around you, and you see this silver metal coming up with mercury. Mercury is heavy. So how much pressure does it take to stop the blood moving past the cuff that's around your arm? And that's your blood pressure. And there are two pressures. The pressure that the pressure of it measures the pressure that the left ventricle actually pushes on the blood to get it out, and that's called the systolic pressure. So that's on the contraction. The bottom one, the second number, is the diastolic pressure, and that is when the heart relaxes. So if you feel your pulse, it's not constant. You go beep, beep, beep. Now, so to be able to not get that feeling in there, but by squeezing on the artery of the upper arm, just until you can't feel anymore, that is your systolic pressure. How much pressure the heart puts on the blood. If it's too high, you've got a problem. If it's not high enough, it's also a problem. So that's how you measure it. And then when you release the air out of the cuff, and slowly you hear in the stethoscope, you'll hear the beating of the heart, And then when you stop hearing it, that's the diastolic pressure. That's the relaxation pressure. And so you need those two to see if you have a problem. Some people have high blood pressure without symptoms, but if it's uncontrolled, you've got all sorts of problems, heart attacks, strokes, and so on. It's easily detected just using a stethoscope and a sphygmomanometer. That's the cuff. Easily treated. The problem is, again, the damage to the arteries makes them less elastic and so on. It affects the flow of oxygen to the heart. Angina, we mentioned before, and heartache. Now, I put in preeclampsia because it's got nothing to do with aging, but pregnant women can have preeclampsia. In pregnant women, they develop high blood pressure, and usually there's protein in the urine, and that's called proteinuria. She often has a swelling and edema of the legs, hands. So there's something, there's a problem. So this blood pressure rising puts the woman at risk of brain injury because it's really high blood pressure during the pregnancy. And eclampsia, so this is before the eclampsia, so this high blood pressure, it could affect the kidneys, the liver, if blood clots happen, pulmonary edema, that means fluid in the lungs. She can have seizures in really severe forms, maternal and infant deaths. So one of the first things they do when a woman is pregnant is keep an eye on the blood pressure. It's higher in very young women and older women, so that's over 35. So if a teenager gets pregnant, it's a good chance that she will develop preeclampsia. So I mentioned these already. And normally, a blood pressure, what they call it standard, 120 on 80. So 120 millimeters mercury for sealing off the artery in the arm. That means the contraction, the pressure of the heart is under contraction. The 80s, the relaxation. That's the normal. It could be a little bit over, could be a little bit less, but that's about normal. The pulse pressure is 40. It's a different measurement. If there's some doctors do it, I've never had it done, but it's normal. So the pulse pressure greater than 40 millimeters mercury is abnormal. A low blood pressure, decreased cardiac output, that's a problem. So that's observed in people when the heart is failing. So the pulse is considered when it's more than 60 millimeters mercury. Okay, so it's high, but it's very important to just to have a look generally. Oops. So the 60, when a blood pressure is 120 over 60, is when it's so. I should just go back. The difference in blood pressure here, 120 to 80, that's where the 40 comes from. If that 80 becomes 120, say, it's like this 180 on 20, that increases this pressure to 60, and that is a big major risk. Now, atherosclerosis it's progressive, built up plaques, or mainly cholesterol, but which is a fat, but calcium also becomes part of it, and we've got a group of red white blood cells called macrophages in us, and they become part of the process of trying to clear it, but they actually stick to it in the process, so it makes it worse. So it affects oxygen and other issues. When the blood flow is when it's impaired, like in ischemia, when you have a blood flow problem somewhere, there are things like angina or what's called intermediate claudication. So this atherosclerosis can manifest itself in different ways. Okay, so there's coronary artery disease, cerebral, that's the brain, and peripheral, the edges. There's heart, the brain, and everything else. So you need to be aggressively lowering. Now, the lipoproteins, or some people are lipoproteins, depends on the university you went to, I guess. The LDL cholesterol, because it's also HDL, high density. By lowering that, you can slowly reduce these. Statins, they're drugs to lower cholesterol. If you had any sort of issue like that, I'm sure you'd be taking a statin of some sort, and heart and artery health returns. It's so important, because if nothing is done, the blood pressure shoots up. And by the way, if there's any weakness, especially in the brain, in the arteries, with the pressure being so high, you can get a stroke. So with atherosclerosis, that's the buildup of this plaque inside. This is in 4 sections. That's a healthy section. You can see the basal cells here, nothing. You get a little fatty streaks, the lipids, and the little foam cells that sort of blow up a little bit. And you get the fibro-fatty plaques, that's the next stage. So you get these pink cells here, the lining, you get this core, fatty build-up there, it develops a core. And the smooth muscle cell, the cells that cause the contraction is smooth muscle, and that is affected by that. It becomes enclosed and it can't move too well. The complications, then you get this massive amount of buildup. The calcification, that's where the calcium comes in, it hardens it. As it gets bigger and bigger, these what's called endothelial cells, you can see it become very narrow. A thrombus is a blood clot, so then that'll form on that as well. So it's not good. Let's move on from the heart to the brain. Now, as we're getting older, we know people I'm sure we all know people with dementia who have it or have died with it or are developing it. It's a form, it describes a group of symptoms affecting memory, thinking, social abilities, and it's enough to interfere with daily life. It's really nasty. Now, dementia usually involves memory loss, that people can't remember. They might have long-term memory of their childhood, early adulthood, but more recent stuff just can't be accessed. And if you can remember, if you're having trouble remembering stuff, like if a friend or your spouse tells you something, 5 minutes later you say, "Oh, I'm sure I was told something. What the hell was it?" That's not dementia. That's just getting older. Alzheimer's is another one of these progressive dementias in people our age or older, or sometimes younger. And there are a number of other causes of dementia, and depending on what's causing it. And some can be reversed depending on the cause. So what have we got? We've got dementia symptoms vary depending on what's causing it. So we have memory loss. This is cognitive. So this is memory and sorting out logically things, usually noticed by someone else. Memory loss noticed by someone else. You don't know you've got the memory loss because you don't have the capacity to think about memory. You have difficulty in communicating, finding words, like I did just before. Difficulty with visual, spatial abilities, and you get lost while driving if you're still driving. You just forget about how to get home. You might go for a walk. You turn a corner, even though you've been there 1,000 times, you don't recognize it. You have a difficulty in reasoning, problem solving. They just can't handle it. Handling complex tasks are a problem. Planning and organizing, so you just can't work it out. Difficulty with coordination and motor functions. So you may end up with problems with walking, with doing things with your fingers. Confusion and disorientation is a big part. There are psychological changes. The personality could change. There's depression, there's anxiety, inappropriate behavior. They go outside for a walk and decide it's too hot, so they strip completely. There's paranoia, people out to get them. And they get agitated very easily sometimes and have hallucinations. And causes damage, a loss of nerve cells and the connections in the brain. So the brain has changed, and it's basically, if it's not too bad, early stage, it just might reverse itself. But if it keeps on going, you just can't. And depending on what part of the brain is damaged, it can affect people differently and have different symptoms. And these dementias, different dementias, are grouped in what they have in common, such as protein or proteins deposited in the brain, or the part of the brain that's affected. Okay, so the protein deposit, like we have fat deposits in arteries. There are protein deposits in the artery, in the vessels, in the brain. By the way, I should mention, I don't know if you know, that the brain itself has no blood vessels. All the blood is around the brain. And there are 3 layers over the brain, so the blood doesn't get through, but everything, all the nutrients, oxygen, everything gets through, goes into what's called the fluid in the brain, the CSF, cerebrospinal fluid, and it's pumped around the brain. And and as it's doing that, the old, oxygen's been used up and nutrients have been used up, and then you get carbon dioxide and other things that have to be rid of. They come up to the surface and they go. So it's not like it's the blood. Okay, the blood is on the outside of the brain. So you just when you're reading about or hearing about it, it's not like the blood goes through the brain. Anyway, now some diseases look like dementias, but they're caused by medication or even vitamin deficiencies, and they're easy to repair. There's a progressive dementia called Alzheimer's, and apparently that's the most common. We don't know why some people get it, and there seem to be. They found recently, this is fairly new, that they found that there are 3 genes, and 1, 2, or 3 of them could be in people's. These are mutant genes, and so it's passed on to generation to generation. So if that's the cause of the Alzheimer in someone, it's possible that their offspring may have it by the time that they're that age. Not necessarily, but possible. Alzheimer's, they have plaques and tangles in the brain. So the plaques are these proteins, they're called beta amyloid. And they affect how the brain works. The tangles are, there's another protein called the tau protein. And they interact with each other, and they form these tangles, and then they clump. And these clumps, they damage healthy neurons and the fibers that connect to these neurons. So it's sort of an external to the nerves, but it's affecting the nerves in the brain. Signs and symptoms of Alzheimer's: memory loss, that is really disruptive. Challenges in planning, they can't plan. You go and want to go to the shop, well, you go to the front door, you turn left, you cross the road and you're there. They can't do that anymore. Problem solving, difficulty in completing familiar tasks. They might start, I don't know, making toast for themselves, but the time delay in making the toast, they've already forgotten about it. Confusion, time, place, trouble understanding visual images and spatial relationships. This is part of the testing process. They have problems with words in speaking and writing. So this is getting quite deep. There's also a form of dementia called vascular dementia. And this is caused by the blood vessels that supply the brain. And they have the most significant symptoms here are they tend to involve speed of thinking and problem solving, not memory, but thinking. And the most common the most common signs are confusion. They just can't sort things out thought-wise quickly enough. They have trouble paying attention and concentrating. They will listen to you. I've had this with my aunt. She died not long ago, and it's getting worse. And she'd ask me a question, I'll answer it, and next thing I know, she's reading a magazine. maybe I'm boring, but she didn't have the concentration. They can't organize their thoughts properly, or their actions decline in ability to analyze a situation. It's analysis. It's a high level of thought. And to develop an effective plan, to communicate. These are high levels that we do normally. Their thinking is slowed down. They can't organize things. They can't make decisions about what's the next step. What do we do next? Memory is an issue. They're restless. They get agitated. And when they walk, if they can walk, it's very unsteady. They quite comfortably fall over. Another one is Parkinson's. And it's a form of dementia. It's progressive. So it gets worse. It's degenerative. So it continuously degenerates the central nerve system. That's the whole brain and the spinal cord. Now, Parkinson's, it damages a section in the brain called the substantia nigra. It's an area that's very dark looking. Nigra just means black. And these produce dopamine for us. And when these cells are damaged, not enough dopamine is in the brain. And that leads to the symptoms of Parkinson's. So what happens, the dopamine is required here. So you get the tremor, the shakes in the hands, arms, legs, jaws, head, everywhere. But they also get a stiffness all over. There's a condition called bradykinesia, where everything is slow. They just can't move. Brady means slow, kinesia means movement. Balance, posture problems, and if they can walk, they'll walk with a stroller, a walker. They're easily confused. When they write, often they'll write in this tiny, small handwriting. Depression and dizziness are there as well. There's another form of dementia, frontotemporal dementia. So the temporal part and the front bit, association with pronounced atrophy. And atrophy, it means that it's slowly disappearing, if you like. It just dies off. And it shrinks. And the frontal lobe is here. The temporal lobes are on the side. So that's where this happens. And they signs and symptoms, they forget things, they can't find words, their behavior and their personality changes. So even the old people, they swear, they steal, increase interest in sex, deterioration of personal hygiene, and so on. They're impulsive, they have poor judgment, apathies where they can't be bothered doing anything. They have poor self-awareness, and some patients also develop incoordination or stiffness of the muscles. So these are all different forms of dementias. Here's another one. It's called Lewy bodies, dementia with Lewy bodies. I don't know if you've heard of these. These are small protein deposits in some people's brains, and they're named after the scientists who discovered them. And these people have problems thinking clearly. They can't make decisions. They can't pay attention. Memory is a problem. Seeing things that aren't there. known as visual hallucinations. Usually the unusual sleepiness during the day. So they're always feeling like they want to sleep. And maybe that's when they blank out and they stare. They think someone with them will think they're looking at them, but there's nothing there. They have problems with moving, trembling, slowness. They can't walk properly. They have dreams, and they, in their dreams they act out physically. They talk, they walk, they kick. All right, enough with the brain. Let's move on to something else. Type 2 diabetes, just for a change. So you've heard of type 1 diabetes. That's a problem with insulin, lack of. And people have to take insulin injections multiple times a day. This is not. This is where sugar levels become elevated and you get insulin resistance. Insulin is there, but the body's not responding to it. So during insulin resistance, because of this lack of response or difficulty, they can't fully absorb and then they can't use the sugar from the food for energy. So the sugar stays in the blood. The sugar just keeps going around in the blood, and that brings around a chronic condition. And this condition leads to some serious issues which have to be managed. In type 2 diabetes, if it's caught early, no problem, very easily reversible. If you let it go, then you've got a major issue. But it's not insulin based. It's a problem that the cells aren't recognizing the insulin. So the pancreas normally produces insulin, and it responds when we eat something. we have in the top of our just outside the stomach, the duodenum has sensors for what sort of foods we've been eating. So when the stomach squeezes out what's called a chyme out of it, it goes against the wall. And all these molecules of sugar, of proteins, of salt, or whatever it might be, the fats, that gets picked up. Messages get sent to the small intestine, and the enzymes to break those down, like the proteins and the fats and so on, are released further down. So they'll mix a bit later. Unfortunately, the pancreas, which normally produces the insulin, with type 2 diabetes, with type 1 diabetes, the insulin isn't produced, so you've got to inject it. With type 2 diabetes, the insulin response, the insulin is there, but the response doesn't move. So this causes the problem. So muscles, liver, and fat become insulin resistant. So they no longer respond to the insulin. And that means they can't absorb the glucose because they need insulin. Now, what insulin is a protein made up of two rows of amino acids, and it goes into the walls of these cells, and it works on what's called a click-clack model. It opens up, top of it is outside the cell, the glucose pops in, and then it does that, and the glucose goes into the cell. If that if that resistance exists, which it does in type 2, the insulin can't become part of the cell. So if the insulin can't be there, then the glucose can't get into the cells, and every cell needs it. So you've got a problem. Now the beta cells in the pancreas become exhausted and can no longer produce sufficient insulin, because they keep producing the insulin because they can't go into the cells, but the cells need the insulin, so messages go back to the pancreas, and it's a terrible cycle. So what are the signs and symptoms? Polydipsia, that's always thirsty. Hyperphagia, always hungry. Polyuria, because you're drinking so much, you're urinating a lot. You have weight loss because your food, once they're digested, the amino acids and whatever just isn't spread through the body properly, so you lose weight. And blurred vision could be a problem. They get headaches, yeast infections, fungal infections due to the high level of sugar in the blood, but not in the cells. Then you get paresthesia, that means tingling in the hands and the feet, again, because the sugar the glucose can't get into the cells. Dry mouth, fatigue, and sore tender gums. That I don't know why it's caused. And so the difference, I mentioned before, the difference between types 1 and 2 diabetes. Type 1 is an autoimmune disease, and it can't be reversed. Type 2 can be. And it often depends on diet. And someone who has a huge amount of sugar in their diet can develop type 2 quite comfortably, and does. So in type 1, the pancreas is unable to produce the insulin, whereas in type 2, it's produced. Just what I've been saying, the summary. A person with type 1 could die without their insulin medication. Type 2 diabetics should avoid treatment with insulin unless the pancreas is completely failing. So they can produce insulin, but it's not effective enough constantly. So this insulin resistance is the problem. So by too much insulin overwhelms all these tissues, like the liver, where the glucose, by the way, if you know, is stored in the liver. It produces very, very large molecules of millions of glucose molecules together, and it's called glycogen, and that's our store. But they can't get into the liver when they don't have it, and it also leads to problems, insulin sensitivity. So the body no longer properly absorbs it, and so you have high blood sugar all the time. Now, the beta cells in the pancreas, they continue. And they're producing insulin continuously. So then, because they continue to produce, not as required, but continuously, they die. These beta cells in the pancreas. And then there's not much insulin, and you get what's called hyperglycemia. And so hyperglycemia is the last symptom of energy mismanagement, and that can lead to the diagnosis. You should be able to, you go through all these symptoms, and you may or may not do anything about them. If you get there early enough, doctors can do something. Just leave it with a dead beta cells, not good. So what factors can lead to type 2? Well, there's a genetic disposition. Okay, that's one thing. Family history, obesity. Very fat people do have very often, type 2 diabetes. If your habits are sedentary, that means you get up in the morning, have a decent breakfast, sit down, read the paper, and then you have lunch, sit down, read a book, have dinner, go to bed. That's sedentary. You're not moving, there's no exercise, you're not stimulating the use of the production of insulin. Decreased levels of high density lipoproteins, that's a good cholesterol, so it reduces it. High blood pressure, a diet high in processed foods. This is again a problem of the excess salt, excess sugars, history of heart disease and stroke, depression, don't look after yourself, PCOS, polycystic ovarian syndrome, often in young women, in the 30s and 40s, elevated triglycerides in the blood, not good. And then there's a ratio of waist to hip ratio. So the hip should be wider, not wider, circumference than the waist. But if it's the other way around, there are problems. And there could be some systemic inflammation right through the body. And factors that promote this systemic inflammation, processed foods again. So if people live on McDonald's, for example, and go home and for dinner, they might have a whole lot of cans and prepackaged foods. It's not good. Added sugars, excessive alcohol intake doesn't help. Inadequate sleep, quality and quantity. Certain autoimmune conditions, a problem, people smoking, if you have anxiety issues, depression issues, they can all lead to it. How do you manage it? You become overweight often. So some loss, and I was just reading recently, even a 3 to 5% weight loss can make a difference, which is amazing. So diet like the Mediterranean diet, fresh vegetables, fresh fruit, olive oil, it's all good. And they call this the DASH, dietary approaches to stop hypertension. Exercise to get cardio and strength, avoid processed foods, which is good. Get sufficient sleep, medication if required. So it can be helped with medication. Unless it's absolutely necessary, insulin should not be used. I should underline the not. Injecting insulin could make it worse, the whole situation. Because the insulin is there usually up to a point. The insulin is a fat storage hormone. So higher insulin leads to more fat storage in the organs. So it could be around the heart, could be around the kidneys, around the liver, making them insulin resistant. No good. Insulin could all be used when the pancreas fails. The beta cells can't be regenerated. So we've got alpha cells in the pancreas, and they make cortisol, and the beta ones make the insulin. And once the pancreas fails, that's it. When caught early enough, type 2 diabetes can be reversed. Lifestyle changes mostly. Medication. Now, you may have heard of bariatric surgery. That's when they may seal off or cut off a section of the stomach. So my brother has a section, he was very obese and still is, but much better. They put a sort of a belt around near the top of his stomach. So he's only got a little bit of space there. So when he eats very, very slowly. And a few mouthfuls is already full. And then he waits till that moves down and then adds a little bit more. So he couldn't control himself, so he had to have the surgery. He's still alive. When caught early enough, this type 2 can be reversed. Yes. Can it be yes, early detection is important. A sufferer is considered to be in remission from type 2 diabetes when they have had normal blood sugar levels for a year without medication. That's the definition. And ladies and gentlemen, thus endeth the lesson. And so, are there any questions I may or may not be able to answer?
I just want to say old age is scary, hey?
It is. It is. We have an amazing instrument, our body. And if you look after it, everything's good. So we just, I'm not trying to scare anyone much, but it's a very, very, very important topic. So,
yes.
So next, in today fortnight, the 14th of November, tomorrow, November, will be our last lesson for the year, and it'll be the second half of this lesson, and about other parts of the body which get older. As I said, some of you came a little bit later when we were chatting early on. Next year, I put down for a hybrid lesson where I'll go in. In fact, I was there on yesterday. I was talking to David. What's his name? I can't think. He was the ex-president. He's now the vice president, and he's been using this hybrid system for a while to show me how he does it. So I hope I'll have to go in and practice. So I'll be in the U3A building, and you can choose whether to come in or I'll be continuing the Zoom, which might suit people more. Others face to face. So it's a small room. We can have 14 in there. I think, remember in the building, U3A building, there's a room, a smallish room, used to be the computer room. I think that's where it is. Anyway, it's I just need to work it out, because we lost a lot. We used to have over 50 people on our lists, but once COVID came in and we started started with Zoom, it took me a while to learn all the bits and pieces about how to record, how to put the things up on YouTube. So I've learned things. I'm glad my brain is good enough still to learn something, and I've got to learn this new thing. But even though I had something like 50, but we've been having up to 18 or 20 with us. But even people who are listed aren't here. At the moment, we've got 10, including me. So either people have lost interest or they're busy or whatever. I don't know. So I intend to continue because I really love doing this and seeing you guys. And I hope you get something out of it. And you've got the notes. Yeah. So,
No, we need a glass of wine to cheer us up, after this lecture.
yeah, oh well, there are other things happening in the world. We need 2 glasses.
Yes, true.
Basil, I can't hear you. No, don't yell. Basil, press your unmute. I can't unmute you. I don't think.
Yes, you should be able to unmute everybody.
Hello?
Yes, I'm unmuted now.
Okay. Now, that's gone. That me unmuting left. I can't do it anymore.
Ah, changing the system.
Yeah. Basil?
Anyway,
I said
I'm
what
going to the doctor after what you said.
Sorry, say it again.
I have to visit the doctor after you said I've had knee problems, and you said behind the knee, so I'm going to see him.
Yeah.
what I said. Yeah, what I said is what I like about biology is we don't have to sit examinations.
No.
Yes. Yes. Biology has changed a lot. There's new stuff coming in almost every day. So I like the research and keeps my brain going too. Yes.
Very important.
Thank you.
It is. Hopefully your brain is still awake.
Thank you.
Yes.
Thank
Yeah.
Okay, so guys, Arthur, are you okay? Is he asleep? Oh. Gosh, I didn't know I had a soporific effect on people. Okay, guys, I will finish up here, and we'll see you in a fortnight.
Thanks,
Okay.
Ruben.
See ya.
Okay, thanks.
Everyone.
Thank you very much. Very good.
All the best. Bye.
Bye.